Hi, this is Dr. Gossett. I'm here with Paul Neville, and Paul's a recent patient. Tell us a little bit about why you came into the office.
I had a whole series of things, but the three biggest were heart attack, stroke, seizure, actually I guess four, seizure, and actually died during the surgery. Actually follow-up with the surgery. And when they brought me back, my shoulder, elbow, and wrist were all out and needed some help that traditional therapies didn't help with.
So you experienced a stroke during this surgery,
Yes, sir.
which affected your whole right side.
Yes.
Your arm, your leg, and your speech,
Yes.
and control of your face.
Yes.
Okay. And so with the traditional care that you had with the rehab, some of this came back, but you were
Yes.
having some intense problems with pain in your shoulder and into your arm. Was that affecting your sleep at night?
Actually, it was. I couldn't get comfortable. It's still very difficult for me to sit, but it was difficult to stand, it was difficult to walk, and
Getting from a lying position to sitting or sitting to standing
was very difficult,
okay.
yes.
And did you, after we had treated you for a few visits using some chiropractic adjusting and some PEMF, pulse electromagnetic frequency for the nervous system, what changes did you notice?
Well, the biggest thing was when I first came in, my arm was pretty much stuck in this position unless I physically forced it down to about here.
And then after a few visits with us?
After a few visits, I can straighten it out completely. I can raise it up.
Before, were you able to elevate your shoulder?
Maybe about that far.
And now you can do what? Okay, very good. So that's after about a half dozen visits with us. Okay. Were you waking up once a night, several times a night? Was it every
Probably
night?
3, 4, maybe more times a night. The pain medications had me sleeping most of the day, and I haven't taken a pain pill in probably a week and a half.
Okay, very good. And how often are you waking up now? Every night several times, or once a night, or?
Probably once a week. Last night was a little rough on me, but and I woke up one time, but that was like one time in like a week, week and a half,
Okay.
something like that.
Okay. So what would you say to other people who've experienced a stroke, who feel like they're kind of stuck and they've gotten as good as they're going to get? The doctor says, well, you're going to have to live with this.
What I would say is that to try the therapy, it worked miracles for me, and I think it would help a lot of other people as well.
Okay, well, thank you. I will note one thing. When you first came in, it was difficult to understand you when you were talking, and that was because of the effects of the stroke on your mouth and tongue.
Yes.
And now you're speaking very clearly, and that's really great to see. Okay, thank you very much.